I'm so sorry this is happening to you, and I can't give you medical advice because I have no idea what's going on with you. But let's talk about problems you can have around the belly button after a tummy tuck. So, having issues with the belly button after a tummy tuck is a relatively common complaint. And here's the most common things that we see. Now, these are not things we see right after surgery, these are things that we see many, many months out. So, the first thing is that the little circle of scar can become thick and hypertrophic and can actually close off your belly button hole. Now, this can be really problematic because things can get stuck inside, they can get infected, they can get stinky and irritated and be very bothersome. Now, when this happens, sometimes people do get irritation to the point where they do actually bleed. So it's always important if you have concerns for your doctor to evaluate you and make sure that the little opening around your belly button has not become stenotic. And there's things that we can do to try to stretch it out. So we inject either a steroid or a chemotherapy agent, which can soften the scar. We can use even just Q-tips to stretch the area as the scar softens. And then there's these little tiny plugs that you can purchase that stick in the belly button to help keep that space open. So the next thing we sometimes see in this location is a draining sinus that comes from the stitch inside. So when we do a tummy tuck, we often fix the rectus abdominis muscles. This is called a diastasis repair. And the stitches we use are big, heavy-duty stitches. They're either dissolvable or permanent sutures. And this problem can happen with either of these options, but it's more common with the permanent ones. So often the knot when we fix the upper part of these muscles is right above the belly button. And if that knot gets bacteria on it, even if it's not a rip-roaring infection, sometimes as that stitch dissolves, if it's a dissolvable stitch, or the bacteria sits on the permanent suture, it creates a little infection that will eventually drain to the skin and create a sinus. Now, if this is the problem, if this is what your surgeon diagnoses you with, then they need to open up a little bit of the incision and remove that stitch. So if it's just a dissolvable stitch, whatever is left of it, they'll remove. And then if it's a permanent stitch, the permanent stitch needs to be removed. Now, the problem with permanent stitches is that it doesn't typically just stay right there. You have permanent stitches all along the repair, and they all have the possibility of having this happen. Although it's most common by the belly button, I've unfortunately seen patients where they had sinuses in multiple places all the way up the upper portion of their abdomen. This is one of the reasons I personally use dissolvable stitches. So if you've had a tummy tuck and you're having bleeding around your belly button very far out from surgery, it's always important to go in and get evaluated to figure out what the problem is, and we almost always have a solution, and they're typically easy solutions.